Good afternoon, everyone. Welcome to Project Positive Planet, the advancement of wellness, spa therapies of the future. Hi, Ashley. Hi, Raphael.
Hi.
Hello.
How are you this afternoon?
We're doing great. Thank you. How are
We're doing
you?
awesome. Thank
Doing
you.
awesome. Excited to have you with us today. So today, again, we'll be discussing the advancement of wellness, spa therapies of the future. And this is episode 2. Joining us is Rafael Reyes, co-founder and CEO of Vita Companies. Ashley De Silva, co-founder and COO of Vita Companies. And me, Stephanie Rest with We Consulting. And today is brought to you by Vita Lounge. And I'm very excited to learn about liquid IV therapy. It's something I've been interested in for years. So Ashley, tell me how you got your start in this.
Yeah. My background is in nursing. I had the privilege of working for my father, Dr. Guy De Silva, who is really considered one of the pioneers in IV nutrient therapy or IV vitamin therapy. We had an IV portion of his practice where we saw patients for all different types of needs and benefits. And then we did several speaking engagements, educating doctors on how to offer this service as something to benefit their patients. So I've been doing this about 10 years now, and I love it. So.
Interesting. And so what inspired your dad to get involved with liquid IV?
Well, he had a anti-aging functional medicine practice, and with that comes a lot of chronic diseases.
What year did he launch that? Because I know anti-aging is now just, more prevalent.
It was way before it was a thing like it is now. Back then, it was a lot of education to the public. But it was in the early 2000s sometime. Before that, he was in hematology and pathology, and then he completely switched into anti-aging and functional medicine because he really saw the need for it, where patients weren't getting better. They weren't getting that true overall healing of the body and their illnesses. So the IV started because he put patients on a long list of supplements, oral supplementation, and they would get a little bit better, but it was hard for the compliance. Not everybody likes to take a whole handful of pills, and he wasn't seeing the effectiveness. So he, went back to his old med school days and remembered the best route of administration for efficacy is going to be IV or injection. So then he, stumbled upon giving the vitamins, amino acids, and minerals via IV. And it just completely would change the result for that patient and help with different chronic illnesses.
Interesting. So what's in the liquid IV that can help with chronic illness or anti-aging or keep us on a healthy track?
So a lot of disease or even symptoms such as fatigue and brain fog, they usually stem from some type of inflammation in the body. And when we're able to dose properly certain vitamins, such as vitamin C, for example, has many anti-inflammatory properties, and magnesium as well. And when we can get it directly into the bloodstream and really allow the cells to function the way they're supposed to and support overall organ health and immune support, the result is really phenomenal.
And I think there's quite a few liquid IV options on the market, right? So what constitutes a good bag or IV or whatever the terminology is? This is
So, it can depend on what your goal for the treatment is. But, in general, a great multivitamin treatment bag would be great for mitochondrial health, immune support, energy, metabolism. It's going to have nutrients like minerals, vitamin C, of course, different B vitamins like B12.
Fatten mentioned something. that's common that we hear now, particularly in our spa and wellness industry. Can it help with fibromyalgia?
Yes, and fibromyalgia patients really do get a bad rap because a lot of doctors don't know how to treat it, and they can't exactly hone in on what's causing it for them. My mother suffered from fibromyalgia before my dad got into this, and that was one of his goals. And he believed that fibromyalgia starts at the mitochondria, which is our energy powerhouse of the cell. And when you can look at something like a Krebs cycle and see what nutrients go in to result a certain energy force, and give them IV or IM, you just basically are reversing that issue for that patient. So we actually see a lot of fibromyalgia, arthritis patients, and they are, repeat customers because they feel the difference.
Right. What about Lyme disease? That's just another thing,
Yeah,
I think.
it's a very popular, it's a common thing. And we do see lots of Lyme's patients. They're looking for immune therapies. And when we can give something IV, we can do much higher doses than what someone can tolerate by mouth, with really little to no side effects. So for those people with the chronic viral infections and things like that, they really, really benefit because it's just giving the body the strength to, silence that virus.
Any contraindications for people seeking IV therapy?
There, of course, the way that we're giving it is infused in an IV bag. So we always want to be monitoring cardiovascular health, kidney filtration, liver health. But for the most part, if there's no pre-existing conditions, these are just natural vitamins. So the same thing that you're going to get through your diet or through supplementation, it's really hard to have an allergy to the natural and active form of that vitamin.
Interesting. So would I need a prescription if I wanted to come to Vita Lounge and get a therapy?
You don't need to come with a prescription. We are a medical facility. So when you come in, you meet with one of our providers, and you would go what we call our wellness exam and go over some of your health history and things like that. And then we're able to administer the treatment.
Great. Amazing. Another question we have is, Fatin is going through a vitamin-rich therapy, but it's tabled due to COVID-19 lockdown. But you were interestingly enough telling me that you guys have stayed open.
Mm-hmm. Yeah, so in where we are and our clinics are, we're considered an essential business, which we were really excited about because we know that our therapies can really help people during a time like this, prevention and also treatment. So yes, we've stayed open. We've been, keeping everybody safe.
So do you want to talk a little bit about the types of IVs that you have and maybe how you prescribe or what's the segments of the IVs?
So we've kind of categorize them to make it easier for the patient experience. So they can kind of, when they come in, they have an idea, I'm looking specific for weight loss, or I'm a marathon runner, or I just want my immune system support. So we've got about 7 different categories, from beauty to wellness to energy, even repair, which is all those inflammatory type disease processes. So we have them, we have a VitaSlim for weight loss. We've got a convention prep. We are in Orlando, and a lot of people come in and out of town for conventions. We've got some for theme parks. So we have a large variety, and we find that giving people those options is really a plus. They enjoy having the luxury of customizing whatever they want.
Interesting. Can you tell us a little bit about your setup too? Jeff has a question. If your centers are medically supervised, and how would that work?
Yeah, so they have to be, because we are giving intravenous treatments. So we are medical facilities. We have teams of doctors, nurse practitioners, PAs, nurses. who all oversee everything and administer the treatments.
Interesting. And are these, or do you have to go through the FDA for these IVs to get approval, or how does that work?
So the pharmacies are FDA approved. They've gone through that regulatory process, I guess, to compound them. And we are overseen and governed by the health department.
Okay.
The ingredients themselves would be FDA approved.
Right.
So all the ingredients, all the vitamins, nutrients, minerals would have that FDA certification and approval.
So my IV bag, how often should I be getting one? Because I'm going to start.
Yes, you should. It varies. For, the most part, and in my experience, if you're just doing it for general wellness, you feel good, you don't really have any issues, once or twice a month is great. If you want to do some vitamin injections in between those just to keep your nutrient levels high. For any of those chronically ill patients, it's usually once a week for at least 4 weeks and then reassess.
And what kind of injections could we be getting in between?
So again, it kind of depends on what you're looking to receive out of your treatment, what kind of goals you have, but a lot of B vitamins for energy, lipotropic shots for weight loss. We've got very unique amino acids to help with, whether it's arthritic joints and things like that. For the fibromyalgia question, CoQ10, that's always great.
Interesting. So you would probably customize like a treatment plan for someone if they came in between IVs and depending on what their goals are.
Mm-hmm, exactly.
And so we have a question again from Fatten. How much does this therapy cost? Like, what's the price point range?
So the IV therapies, from just a hydration bag starts at just $75, and they go up to about $225. Just really depending how much nutrients are in each.
And do you have a membership? Are you selling packages? Because it doesn't sound like a one-time thing.
So we like the commitment. We don't have a membership right now, but we do have packages. So a lot of people will commit to that package and come in and use them as they need them.
And then another thing, which you said is now that we've all been shut in for a couple of months, a hot ticket item is the weight loss therapies, right?
Mm-hmm.
So
yeah,
speak to a little bit of those. And I have done the Hcg diet in the past. So
yeah, the Hcg diet is awesome. It's been around for a very long time. Dr. Simeon was the original. He wrote the book Pounds and Inches, but we have several people who opt to do the Hcg diet. I have done it myself too. And people see results. It's almost unbelievable, but really 1 to 2 pounds of weight loss a day. The beauty about the Hcg is that you're not losing your muscle tissue, because a lot of times when we restrict calories and we're kind of in that starvation mode, the body will naturally break down muscle. So it's a very quick and expedited way to kind of see that scale budge. Your clothes will fit a little bit better, and really get people off of their food habits. So we're kind of retraining you how to eat, portion control, lean, clean, healthy eating, and then they see great results.
And what is Hcg?
So it's human chorionic gonadotropin. It's basically a hormone stimulant. They use it in men sometimes to stimulate testosterone production and things like that. So what it's doing, and actually to give kind of an extreme example of the purpose of Hcg in the body, is during pregnancy, it's very, very high. And the reason it's high, it's actually a safety mechanism for the body, that if the mother ever went through a period of starvation or not getting enough food, it would then release the storages of fat to feed the baby. So that's kind of what we're mimicking. It sounds terrible, but with the shots, small doses of that Hcg, we are lowering our calories, and the body's almost saying, oh my gosh, we're not getting enough food, start releasing those storages of fat, and that's how we yield the weight loss.
And how long would you be on this diet for, and how often could you repeat it?
So there's a 26-day plan and a 40-day plan. So really 40 days would be the longest cycle that you want to do. We have a 6-week waiting period in between to do another. And that's really just to ensure the body doesn't get used to the HCG and it doesn't work as well.
That's interesting. Fatin had a question about vitamin B. She's been taking it for 15 years, but she's a frequent traveler too. She wants to know if there would be any prolonged effects or any recommendations that you would have.
To add to her B vitamins or her supplementation?
I'm assuming that she's asking, since she's been on it so long, should she alter, or would there be any prolonged effects from continued vitamin B use?
So it really depends on what type of B vitamin she's getting, or he or she, I'm sorry. There are, pharmaceuticals, and then there's compounded natural forms. So if it's a pharmaceutical synthetic form, there could be risks of long-term use. Cyanocobalamin does have small traces of cyanide in it, and I'm sure preservatives. If they are on more of a natural form of it, there's really no benefit to stopping it. B vitamin is such an important nutrient in the body. It's a water-soluble one too, so you cannot overdose on it. So, yeah.
Interesting. She's correcting and saying B complex.
Okay. Yeah. Again, check with your doctor, but what was that, Stephanie? I didn't hear you.
Oh, I said I'm sure there's variations of that as well.
Yeah, different chemical compounds, so it'd be hard to say.
Broco has a question joining us from Mexico, Yucatan. Have you seen an increased trend in IV treatments?
Yes, they've been around for a long time. Like I said, in the early 2000s, we were doing them. It's now almost, obviously, awareness, whether it's on TV, the celebrities are doing them, or professional athletes. And they're being offered more and more within doctors' offices. But I think that a lot of the mentality of people nowadays is really about prevention, and they're looking for that extra edge to feel good, to be optimal, to think clear, and have the best health and not get sick. So there's definitely an increase in people looking for it. And wanting it to just be healthier.
Mm-hmm. Well, and I thank Philippe joining us from California. He's teeing me up for my next question. Are there specific brands you recommend? And is there one that spas can use safely? Because I'm excited about, you have these wonderful locations in Orlando, but tell everybody about where your business is moving to and how you're expanding with other partners.
Yeah, so we have our brick and mortar operations that we are currently operating here in Central Florida. We have 5 locations in Central Florida. We have 2 additional that are going through development. And we're also expanding into the New Jersey and New York area, as well as additional cities within Tampa Bay. But what we felt that it was such a great model and something that we believe in making available to as many people as we possibly can, that we created our Vita Spa model. And that Vita Spa model is essentially an out-of-the-box IV therapy lounge. So we would provide all medical oversight. We have spent years and years and years and probably hundreds of thousands of dollars in ensuring that we are doing everything correctly, properly, taking the patient safety in mind, and also how do we protect the practice? How do we avoid something that can potentially go wrong, as it can happen in a medical setting, and how do we minimize that or eliminate it altogether? And we have spent many years perfecting that and spent a whole lot of money being able to achieve it. So what we do is we have our Vita Spa model that we would bring into one of these existing spas, which would essentially, have a ready to go IV clinic.
It's interesting because a big question we've been getting over the last 5 weeks of doing these webinars are, what services will I be able to offer? What's going to be in demand? And immunotherapy therapy is one of these. And on yesterday's call, we were discussing salt therapy with the halo system and inhalation of salt, and how that's great for the immune system. And Leo was sharing that he can repurpose some of the space in the spa. So could that be something you could partner with, say, a Four Seasons or a day spa, and take some of that space and repurpose for IV therapy or injectables or any of these kind of therapies that might make that sound like they're in high demand right now?
Yes, and to add to that demand, what we have gone through with COVID-19 or the COVID-19 pandemic is that it has shifted everyone's focus into, how do I keep my immune system strong? How do I not get sick? How do I not catch a virus? So what we have seen in our business model is that the demand for the immunity type of IVs has gone through the roof. That very quickly became our number one selling IV, whether it was our Vita Immune IV, which gives a high dose of vitamin C to boost the immune system, or our antiviral IV, which has a combination of a lot of minerals and vitamins that are very good for the body's ability to fight off viral infections. So the demand for those went through the roof. And to help that was that the governments here in the US and China and throughout the world were performing studies as to what are the effects of high doses of intravenous vitamin C to fight COVID-19, and they got great results. And they did the studies, and they found that patients that were doing the high dose vitamin C intravenously had recovered quicker than the patients that were not. So that when that hit the news, obviously a lot of people started to search for that type of treatment here locally for us, and the demand it did increase greatly.
Okay. Interesting. And Vivian has a follow-up question. She's in Colorado, and she would like to know the requirements if a spa, the spa would need to include that kind of service. So do you want to just say how it would work? So say we're going to Vivian's spa in Colorado, how would you set her up for success?
So, the very first thing that we want to do is understand the local laws and regulations, because every state operates differently as far as how they regulate medical practices. That information can be found through the local Department of Health, also understanding, again, the state legislation as far as what requirements they may have. Once we have gone through that initial study, then we make all the determination and set up a plan to how we launch into that city. How that would work is that we would send someone from Vita Spa to come into that market, study the market, meet with the individual spa owner, talk about specific goals, and we share the requirements in order to establish that partnership. It's a very simple process, very straightforward. Again, our hopes in having developed this model is to make something that it can very quickly be established and very quickly have success, and that's the whole essence of that model.
And something we've discussed as well is you would actually kind of connect and bring in the staff for those services and essentially train them, and they would be a part of the decade you've spent in this, Ashley, and have that knowledge, right?
Yes, we would be in charge of making sure all the right not only licensees are there, but also the right, personalities and talents and things like that are there to make sure that culture, stays within. But yes, we would help and provide support, training, and everything that, they need to know they can and cannot do.
Mm-hmm. And one thing I love about this too is coming from an operations background and doing anything new or anything within the hotel, there's so many layers. But what's interesting is you actually identify the property, right? So you're taking on the insurance and the responsibility for the services, correct?
So part of that model would come with medical malpractice insurance that we would provide for all of the medical staff, the doctors, nurses, and any other staff within that component of the business. So yes, that medical malpractice would cover those professionals.
And what I think too, when I'm envisioning Vita Lounge, is it seems like a joyous place. I mean, I know it's kind of a serious thing. We're talking about taking care of our immunity, but it seems to be fun. And you've talked about potentially having like virtual reality glasses, or people could do Bluetooth calls and things like that. I know we're all kind of multitasking, but it could be either a super relaxing wellness experience, or it could be where we're always multifunctioning. We're on our laptop or we're on our Bluetooth call while this is happening, right? Or am I wrong?
Yes. Yeah, we have a lot of people who will come and spend their lunch break with us. A lot of like moms, daughters, husband, wives, they'll come together and, enjoy getting poked with a needle and receiving their treatments just because they feel so good. So we have worked very hard to create a very fun clinical setting that people want to be a part of.
Right. Yeah, I didn't feel like it was like a sterile type of, not that it's not sterile, but there is fun happening and things like that. So another question we have, I saw here, is experience with home care. So this sounds like, if you're creating a loyal following at your brick and mortar locations, you have pop-up locations, you're doing conventions. I've been trying to get something like this into our wellness pop-ups that we do for conventions for some time. But you also are in the home care space, right?
Yes, we do provide in all of the surrounding areas of our clinics in-home services. So we have a team of nurses who specifically handle those. And it's essentially the same process as if they were to come into one of our stores, but we're going to them, we're providing them that wellness exam and then administering the treatment. So it's just more comfortable, or typically it's those who don't want to leave the home, whether they're not feeling well, food poisoning, a hangover, anything, and they'll just prefer that in-home service.
And are insurance companies covering any of the cost of this, or are these all privately paid for services?
Insurance does not deem it medically necessary yet. So they are self-pay, but they can use HSA accounts and things like that.
Mm-hmm. Victor had a question. Could this be something that we utilize on cruise lines? I know coming back for the cruise lines, it's going to be interesting and how they rebound. Do you have any experience with that?
It is, and we have done cruises in the past, and we're actually the only IV therapy company that we know of that has been approved by Carnival Cruise Lines to go on their ships and do IV treatments. So they will have us out for special events such as music cruises, where they'll have 4,000 to 5,000 people who are doing a whole lot of drinking and need help the next day. So if for Carnival, for example, they set us up with an entire floor with seating and all the equipment that we needed, and directed their cruisers to come and see us in the event that they needed that. And what was cool about it is that the medical team on the cruise was so happy that we were there, because they said that typically the number one issue that they have is dehydration. But believe it or not, cruises don't have the equipment nor the training to offer IV therapy on the ship. So they were super excited that we were there, because again, typically when someone comes because they're dehydrated, they just have to send them back to the room and tell them to drink water. So we are, cruise is also another great area to offer these types of treatments.
Interesting. Claudia has a question. Have you worked with any other companies abroad?
Not abroad, no, not yet.
Okay, but you'd be open to exploring that.
Yes, we would.
Depending on the opportunity. Great. So it sounds to me like this would be a great thing for rock concerts as well. So maybe you could partner with some musicians.
Yes. And actually, we've done a lot of, here locally during the concerts, we've done the Backstreet Boys most recently, and a lot of those types of, musical acts and local celebrities will have us come out.
Mm-hmm.
Yeah, they've had a resurgence, huh? The Backstreet.
They did, yeah.
Based in Orlando, your hometown, right?
Yes.
Yeah. would you like to share your growth plan? So maybe take us like your big, exciting vision for 5 years down the road. And would you be interested in working in the Middle East?
So the answer, I'll answer the first question first. And the first question, as far as the growth plan, is that we intend to continue to expand our brick and mortar operations. We have found in the cities and towns that we are going into, although this is relatively unknown initially, it catches on like wildfire. Just as anything good does, right? So for example, when we initially came into Orlando, or the Orlando market, no other business existed in the Orlando market that did what we did. We quickly were able to, within 3 years, establish a tremendously huge patient database, and quickly grow from 1 location to 5 locations within this market. So again, the growth plan is to be able to duplicate what we've done here in the Central Florida market and expand that throughout the U.S. Second part of the question, as far as the Middle East, is yes, of course we would be. We do have a vision to one day be able to expand outside of the U.S. as well and offer these services in different countries.
Okay, we have a really great question from a spa developer and amazing consultant, Lynn Curry, joining us also from California. In the early stages of development, so say we were building out a spa, how much square footage would you need to operate successfully? So what would the minimum footprint be?
That's a great question. So our footprint for our model is 1,200 square feet. So we typically try to go to from 1,000 to 1,200 square feet, 1,200 being the most optimal, 1,000 still maintaining its functionality. So
Okay.
you don't need a tremendous amount of space.
And how many guests could you see? So how many stations, I guess, if it was liquid IV, would you have in that 1,000 square feet?
Sure. So with our current model, we have a large IV treatment room that we typically have enough space to fit 8 chairs, typically 4 recliners and 2 love seats for a total of 8 seats. Then we'll add additional private rooms, which we typically will attempt to have 2 private rooms. Will then fit an additional 2 chairs each as well, or 2 recliners each. So to answer the question, it's roughly 12 chairs, recliners per location.
And how quickly are you turning those clients?
Every 30 minutes, every 30 to 45 minutes. So look, in today's day and age, everyone is looking for convenience, right? So typically, I'll give you an example. We have patients that suffer from POTS disease, and POTS disease it leads to dehydration. So in most cases, those patients have to go into a hospital, go to the ER room. They have to spend 2, 3, 4, 5 hours receiving this IV treatment. Well, they opt to come to us because we can perform that same treatment for 30 minutes and hundreds of dollars less. So, people are looking for convenience, affordability, and a high-end experience. And that's what we have built is have that convenience. As you're coming in, you're doing a medical procedure. We accept walk-ins. We don't require that you set an appointment. So you can be in a leave for your lunch break at 12 and say, let me pop into Vita Lounge and get an IV. And we'll get you in and out before you have to go back to work. And you may still have time to eat lunch. So we try to, we have
smoothie while I'm doing that.
Yeah, you totally can. You totally can. But to answer your question, it's about every 30 minutes we can turn a chair.
That's incredible. So it sounds, and also in your plan to partner with spas, what's the revenue model look like? So how would you align with that partnership? Because I thought that was an interesting selling point.
So with our revenue model, what we tried to do is that we enter into a partnership with an existing spa. The spa would have to provide the space. We come in and we provide essentially everything else, and we can talk with each spa. We have specifics, and I really don't want to generalize what the model looks like, because not every spa is obviously set up the same way. So we do have flexibility from that standpoint, where we try to work with the individual spa based on size, number of patients, location, area that you may be located in. So we do maintain that flexibility that, we just try to find a model that works for the individual spa.
Right. It was particularly attractive to me because I felt like, there doesn't have to be a huge initial investment, like capital equipment or something like that, for the spa to get started, which is attractive. Someone has a question: are the IV bags pre-mixed? And does that make a difference?
It does make a difference. So at Vita Lounge, we prepare them for each patient that comes in. So none of them come pre-mixed from a pharmacy, frozen, nothing like that. We offer a very large variety of different vitamins, minerals, and amino acids. And the reason we do that is because in our experience, the ability to customize those treatments is really, really important. For example, a B complex is going to come, with anywhere between 5 and 8 different B vitamins. And if somebody has a sensitivity to one of those, you can't give them any. So we have each individual one, in a vial that we can draw out, and we can also customize dosing. So if they come from their doctor and their doctor wants a specific dose, or, our providers decide that they need an increase in that dose, we can do that. We have the freedom to do that and the knowledge on how to do that. So we prefer to prepare them all ourselves.
Very good. So any other questions, everyone on the call? So tell us about your brick and mortar locations and where they are.
So our Winter Park one is our original. That one is right in the heart of downtown Winter Park, on Park Avenue. And that one is cute, quaint. We have our Dr. Phillips location, which is in Orlando near the attractions iDrive. That is our second store. And then we have Lake Mary, which is more residential. So a lot of people who, live and work in that area will come there. And then Winter Garden is also very residential, but close to Disney. So we get we see a lot of travelers.
So the growth is kind of amazing. When did you open the first location to having all of these locations now?
It was early 2017.
So just 3 years ago. Wow. Mm-hmm. We have another question. Is there any pathway for your clinic? How do you assess and recommend TX for your customers?
Treatments. So it really comes down to the providers and the nurses' knowledge of each individual nutrient, which does take time to develop that knowledge. It's unfortunately not something that we're taught in our basic training. Or if we are, it's literally 1 semester and that's it. So understanding how these, nutrients can benefit a specific person, whether it's their disease or their symptoms or what their goal is. And that's kind of how we determine which bag would be best for that person. So some of it is the patient really saying, I'm interested in this one, and then us educating them on it. Or them coming in and say, what do you recommend? This is my laundry list of things I want to fix. How can you help me? So education is something very important to us. We know that a patient will be more compliant when they know why they're doing something. So we spend a lot of time in not only educating our team and our staff, but also our patients.
I love that. And, a lot of our luxury spas, it's all about personalization and customization. It seems like that's what you all offer as a part of the service. It's not just, hey, sit down and have your IV bag. It sounds like it's very personalized, which is lovely. Yeah. So we have another question. How often should you visit for IV therapy? What about the injections?
So typically, like I mentioned earlier, if you are just coming in for general health and wellness and don't have any chronic diseases or symptoms that you're trying to fix, essentially. We say once or twice a month for the average person. Anybody who is, inflamed or has any type of immune issues, we would recommend typically more frequent treatments, once a week for 4 weeks, and then kind of tapering down from there. We understand not everyone wants to come every single week. But for the injections, it is different. Any water-soluble nutrients, we're going to recommend weekly. That's about how long the body takes to utilize them. For best results, you can come in more spread apart. You'll just be declining every time and then building back up. And then for any fat-soluble vitamins like vitamin D, it's usually every 2 weeks or so. Okay,
great. And Michelle had a comment, which is pretty brilliant. In Nashville, she capitalized on the pre and post IV treatment retail opportunity as well. Is that something that you all are doing? Is there a retail opportunity?
In terms of retail opportunity, as far as retailing the actual bags?
No, probably selling complementary things before or after the treatment.
Well, yes. So with the IV treatments, and I hope I'm understanding the question correctly, is that, with our recommendations, we do have an opportunity to recommend lots of supportive type treatments that would enhance the actual IV treatment. For example, the shots we were just talking about. Typically, when someone will come in for an IV therapy, it is very seldom that they do not add a vitamin D shot, because you can't add that to the actual bag, being that it is an oil-based, not water-soluble nutrient, along with other add-ons such as glutathione or things like that. So from a retail perspective, yes, the second and third sales are very, very prevalent. We have lots of success with them, with people packaging a lot of these treatments to better support their IV therapy.
Okay, but is there not an IV take-home option, but perhaps like a supplement that you would say, oh, well, take this daily afterwards, and I could buy that? Or I think that's
yes. We were actually no, absolutely. I apologize.
On the way out the door.
Yeah, no, completely. Now, yes. So we are currently in the process of developing a product line to take daily use. So as far as how much success we'll have with it, can't share that yet because we haven't experienced it. But we also do see the opportunity with people getting that supportive treatment, whether they can take in a high quality nutraceutical type product to support their the time that passes in between each treatment. So yes, that is a great question and great idea from Nashville.
Okay, well, it sounds like it worked for Michelle. Another question. So if someone has an existing relaxation room, could they convert that to an IV therapy lounge?
Yes, you can convert. Again, depending on the scale, we would leave to the individual spa owner. Now, we'll have some minimum requirements, but obviously, we know that the single most important part about the model is providing a relaxing area that someone can come in, having a highly convenient experience and a very high level experience. So as long as we can provide those things, the size of the room really would be something that would be left up to the individual spa. And again, we'll have some minimum requirements as far as, but our model is 1,000, but you certainly can go smaller if you have to.
Okay. And do you all have an average cost per treatment?
What's the average cost for like the IVs?
That ranges. It really does. We would be, that would be something that we would speak to the individual per spa that would have an interest in that. Not something that we would share at this time.
But the lowest is 85, which seems.
As far as the retail cost, yes, the retails, they start at 75, they go up to 225.
Mm-hmm. What about CBD? Could that be administered through an IV therapy?
I have not come across that, and I'm pretty in tune with the pharmacies and what they're making. So maybe in the future, I don't think that it's if it is being done, it's not necessarily something that has come to market yet.
Okay, very good. So that is our last question. Any final comments about the amazing services you all provide?
Well, thank you so much for giving us an opportunity to share, what we do and our passion for what we do. The final comments is that we do see a tremendous opportunity for the type of services such as IV nutrient therapy in terms of people looking for immune boosting support. As we all know that, the world has changed. So, what we have seen in our model is that the focus is heavily shifting into immunity. Is how do I boost my immune system? If I have to go back out into the world, if I have to go back out into stores and work and send my kids to school, obviously having all that exposure to potential viral infections, how do I make my immune system strong enough so that I remain safe? And that truly is where a lot of the focus is shifting for the consumer. You'll see more and more businesses starting to offer solutions where you may not necessarily have to come into the business in order to do business with that company. Well, that isn't good for companies like ours that require people to come in and visit, and spas that require people to come into the spa. So what it is important is that if we can offer services that we can tell people that we will help boost your immune system along with all these other great services that we offer, and we feel that there's a great business opportunity in doing so.
Awesome. Thank you so much. And Ashley?
Well, to that, where everybody's top of mind is immune support and things like that, what I find so rewarding about the IV nutrient therapies is really the instant gratification. I think with health, a lot of times it's a very prolonged process where you have to be consistent and wait, sometimes weeks or months to start feeling better, whether it's a new medication or just put on oral supplementation. With the IVs, a lot of people feel better halfway through the treatment. And I think that's a big thing in our culture now is we want it now. We want our internet fast, we want our orders fast, we want everything fast. So I think that's another great appeal to it, and it's good for you. When it comes to healthcare, it's good for you, and it's really rewarding.
Absolutely. Well, I am certainly excited to try it very soon. And I thank you, Jessica and Raphael, and wishing everybody a great Thursday. Thanks for joining Project Positive Planet.
Thank you.
Thank you.
Bye.
Thank you. Bye.
Great to see everyone.